So we'll kind of get started. The idea behind this tonight was just to, again, hopefully fill in some gaps and provide sort of a framework or outline for not only what we're concerned about and why periodontal disease is even an issue, but talk a little bit about what we actually do. Sometimes people are surprised to hear how many steps are actually involved, and even to appreciate at times that it's very similar to what you might experience at your own dentist, albeit with, general anesthesia and obviously some different treatment decisions that we would make versus if we were talking about a person's tooth. So the first thing I just wanted to touch on today is why we even talk about this. And that has to do with the fact that the prevalence of periodontal disease, which we'll define in a little bit, is actually exceedingly high. If you look at certain sort of publications in veterinary medicine, you can find statistics that say that patients, pets, both dogs and cats that are in excess of 2 to 3 years of age, a significant proportion, sometimes as high as 60 to 70%, can have some evidence of periodontal disease. And certainly as a condition, it's probably the most common condition we see in general practice on a daily basis. And it's something that, while we, as we'll talk about, sort of worry about perhaps a little bit more in smaller pets, with smaller patients, large pets are certainly not immune to it. And, just like sort of, the human side of things, there are certain pets who are at more risk. For example, smaller breed dogs. We've taken dogs, at least the ancestral dog, and we've sort of shrunk them down. And in some cases, like with the pug, for example, we have taken these heads that should be this big and we've sort of squashed them. But one thing we haven't done is we haven't changed the number of teeth that are present in the adult dog mouth, which is 42. So if you compare the head of a Great Dane to that of a small pug, you recognize that these teeth, they have to go somewhere. Something has to happen to accommodate these teeth. And just as an example, this is one of the reasons why these dogs in particular have such a high risk of periodontal disease, is the teeth end up twisting, turning, and ended up occupying positions in the mouth that not only can trap food particles and more bacteria and plaque, but can antagonize each other. You can have, for instance, abnormal wear on teeth. So small breed dogs, certainly the smush-faced dogs, historically are at greatest risk. And it's also fair to say that there are certain conditions that dogs and cats can have that could predispose you to having more periodontal disease. Certainly conditions that modify, or I don't want to use the word suppress, but for lack of a better word, suppress the immune system in a way that could put you at greater risk. You have to keep in mind that, so much of what we do, believe it or not, is very similar to what people experience. In fact, the anatomy, the physiology of the dog and cat is not that far removed. It's hence the reason why so many of the medications we use are actually human drugs. And one of the things that I think it's important to appreciate is that, if you've ever had a cavity, or perhaps in a situation where you needed a root canal, I mean, that one tooth, that one nerve that's aggravated can be quite painful. And in the case of a dog who might have multiple teeth in its mouth that are problematic, you would expect at times that they would show clear evidence of that. But the surprising thing to us is that we can oftentimes get into a procedure in a dog that seemingly has just an awful looking mouth. And you have to recognize that this dog had been living with this problem for quite some time. There may be, 10 or sometimes 20 teeth that are problematic, painful, perhaps even abscessed. And yet up until the very end, they were eating and drinking and carrying on normal. So the sort of, for lack of a better word, obviousness associated with dental issues, it's not always there. It's not always what we think it's going to be. Conversely, oftentimes, we can be surprised. It's very easy for us to be in an exam room, pick up the lip and see that a dog has a lot of plaque, tartar, bleeding gums, and a strong odor from its mouth, indicating that this dog does in fact have periodontal disease. However, with respect to patients who seemingly don't appear to have a lot of dental issues, oftentimes when we move forward with the procedure and we start taking the x-rays, we recognize that in fact, yes, there's a lot of painful teeth, problematic, and we didn't appreciate, and certainly the owner didn't. Now, sometimes we get the question. Actually, and you should mute your microphone. Oh, there we go. But one of the things you have to realize is that they all experience pain the same way we do. They're just more tolerant and more stoic with respect to how they handle it. So, don't be fooled by the fact that, your dog may have a strong odor, cat may have, bleeding gums, yet they're still eating and drinking and behaving normally. I wish I could explain why they do. Maybe if they could talk, we'd hear more from them. But the reality is sometimes it's not as obvious as you would expect it to be. Now, just as an aside, one of the considerations that certainly human dentists have to deal with when they're treating patients, especially patients who have more significant periodontal disease, is certainly the systemic risks that can come along with problems in the mouth. Now, keep in mind the mouth is not a sterile environment. There's a tremendous number of different types of bacteria, protozoal organisms, and even fungal organisms that live in the mouth and do so normally. One of the interesting things I'll point out is that when we start getting pets who have periodontal disease, we do see a shift in the types of bacterial populations that, sort of take up space. And these are bacteria that, of course, contribute to the overall problem. In many patients, in most patients, I would say, the body, especially the body's immune system, is already fairly well adapted at confining the issues to the mouth. Certainly, the problems on the teeth or in the gums can affect the bone and the surrounding tissues. But most relatively healthy patients are lucky in that what's going on here in the mouth doesn't gain access to the bloodstream in a way that would cause severe systemic disease to other organ systems. Now, that doesn't mean it doesn't happen. And certainly there are patients with underlying diseases, certainly diseases that would cause suppression or dysfunction of the immune system, even conditions at times like diabetes, or in cats, if you have underlying kidney or heart disease, what's going on here in the mouth can seed or travel to these other organs and contribute to ongoing damage or even cause damage that we could otherwise avoid. Certainly, in full disclosure, there's a lot more literature on the human side to demonstrate that this is the case. Unfortunately, it's a little bit more difficult to come by on the veterinary side, but because of the close parallels, especially with respect to the way our bodies work, we have every reason to believe that there are those patients who could easily be dealing with, systemic organ conditions they could have otherwise avoided had their periodontal disease been identified and treated long before it became problematic. Of course, all of us think about the more immediate issues of pain and discomfort in the mouth, and that certainly is a consideration. And we're going to sort of talk just a little bit more about that going forward. Now, if we talk about a more formal definition of periodontal disease, since I'm using the term, we're talking about a condition whereby through the activity of bacteria, some of the other organisms in the mouth, and the body's own immune system, we begin to get breakdown and inflammation and sometimes infection of the tissues in the mouth. So this is tissue. When we're talking about tissues, we're talking about teeth, the tooth roots, the gums, the ligaments that actually attach the teeth to the jaw or the bone. Believe it or not, the teeth are not sort of fused to the bone. There's actually a ligament called the periodontal ligament, which is responsible for sort of locking those teeth in place. Certainly there are, blood vessels, nerves, and other tissues that in severe cases can be affected, including muscle. But when we use the term periodontal disease, oftentimes we're talking about, damage, inflammation, infection, things that are occurring to structures in the mouth. And that's admittedly more of a lay description without using a lot of unnecessary sort of medical terminology. And one of the first things to recognize is that, and we'll sort of touch on this several times, is that even though we can look in the mouth during the course of an examination and we can get a sense of what we're dealing with, does the patient have periodontal disease? Does it not? And perhaps even get an idea of how severe it might be. One of the things that's really important to understand is that the majority of quote unquote periodontal disease occurs underneath the gum line. We can't see it. And that's one of the main reasons why it's so necessary when we're actually performing a procedure in hospital that we take x-rays, because that's the way that we're able to look underneath the gum line to determine what type of damage, if present, is going on, and of course decide how we're going to address it. Along with that, as I'm sure many of you are used to, we probe the teeth in much the same way that the dental hygienist does to get information. And it's the sort of all that information we get from the probing, from the radiographs, from our own investigations that allows us to come up with a composite picture of what we're dealing with, and then of course devise a treatment plan. But without x-rays, you have a very hard time knowing the full scale or scope of what we're dealing with. And this is why, and we don't see it so much anymore, but about 5-6 years ago, one of the things that was in vogue was this idea of doing what they called a no anesthesia dental procedure on more dogs than cats, where they would sort of wrap them up in a bundle. And we saw a fair amount of this. The pets would come in, we advise the owner of the fact that the pet had periodontal disease, again, usually small breed dogs, and they go to one of these places, their teeth literally would just get scraped. To the naked eye, they'd look great. When we would see them, 6, 12 months later, the owner would bring them in, they would have problems. And of course, when we took the x-rays, we would find that virtually all the teeth were rotten because they only addressed what they could see and they never really addressed what was going on with the tissues underneath the gum line, which they just couldn't see. So what are some of the hallmarks? Well, first of all, and I know this may seem sort of jokey, if you will, but dogs certainly have, even normal dogs with no periodontals, they have a slight odor to their mouth. But I think it's fair to say when you start to develop periodontal disease, you start to get a very strong, what I would describe at times as almost a sickly sort of sweet smell. And certainly the more advanced things are, the stronger the odor is, and then certainly the farther away you can at times detect. It's probably, maybe it comes as a surprise, but sometimes I can just walk into a room and smell the dog's breath, and that is not something that could normally occur. So obviously, the odor you're appreciating, especially when your dog's mouth gets close to you, is one of those tip-offs that, hey, something is going on here. Certainly, one of the things you have to realize is that their gum tissue should be sort of a nice, sort of calm pink color. And when the gums get very red and get angry and inflamed, that's another indication that, that there's likely periodontal disease going on. Certainly, one of the more dramatic things in the hallmarks is, getting sort of large, or not large, but heavy deposits of not only sort of biofilms and plaque on the teeth, which you can't always see, but you can sometimes feel, but it's the mineralization of that material. When you start getting these really calcified plaques, it may take on a yellow, green, brown, or even black color. That's a really good indication that we have periodontal disease that could be well advanced. Just keep in mind, not only is a lot of that material that you're seeing on the teeth a consequence of the activity of bacteria in the mouth, but the bacteria, the bacterial byproducts are certainly going to be a target for the immune system. And with respect to the gums, when these two things kind of interact at the gum line, you can begin to get things like gum recession. You can obviously get exposure of tooth roots, all of which can be problematic and painful. Now, this next sort of clinical side, if you will, may seem a little silly, but oftentimes in small dogs, some of the first teeth that are lost are the teeth in front that we refer to as the incisors. And dogs have about 12 of those, 6 on the top, 6 on the bottom. It's not uncommon for owners to literally be able to take a finger and wiggle some of these teeth. And certainly any evidence of mobility in teeth is an indication that these sort of structural elements that are supposed to hold the tooth in the mouth are compromised. And this very well could be a source of pain. Furthermore, there are some other things which, believe it or not, are not uncommon. At times, abnormal swellings, around the upper and lower jaw could be an indication of things like abscessation, among other things, and certainly a source of pain or discomfort. A real reluctance, if you will, to have you as the owner around the mouth or the face, a real aversion, might be a sign that the dog or cat is experiencing pain, along with a reluctance to eat hard food. Many of our pet owners do feed, sort of commercial kibble that's hard. And if they're having difficulty doing so, you may see them refuse to eat unless they're offered something soft. And at the same time, you may see them eat perhaps only on one side and sort of have food spill out their mouth. These are all potential symptoms of the fact that, hey, there's pain in the mouth and there's a problem that needs to be addressed. And it's also fair to say that by the time we see evidence of a patient who has periodontal disease, we're past the point where any home care or remedies are likely to make a difference. We have to sort of bring them back to square one and then work on things that can help prevent or at least slow the pace of periodontal disease in the future. But we're past the point where, brushing teeth, for example, is going to be sufficient to remove some of these calcified plaques and deal with some of the underlying issues. Now, as I was saying, you can do a visual inspection at home. You can certainly, use your nose as well as your eyes. But as I was referencing earlier, with respect to the need for radiographs, we struggle with the same thing. So when you as the client come in and we always make, looking at the mouth part of our physical examination, it can be difficult for us to assess how bad the situation may or may not be. Certainly, and I think, Olivia can attest to this too, we've all been surprised. We have a mouth that seemingly doesn't look that far down the periodontal disease spectrum that ends up being very problematic, where many teeth have to be removed. Conversely, a mouth that may have a strong odor, a lot of heavy deposits on the teeth, once cleaned, may not reveal a lot of underlying issues around tooth roots. So even we can't get a really great sense of what we're going to deal with. And this is why proper investigation is so necessary. If you're not doing radiographs or x-rays, I mean, to be fair, based on the sort of governing bodies in veterinary medicine, it's probably a form of veterinary malpractice and certainly not fair to the pet. Keep in mind, both of those things, the investigation that we do and the radiographs require anesthesia. We can't just have the sort of reason with your pet and say, hey, lay there for 15 minutes while we complete this assessment. We do have these tools. Actually, there's one tool we on occasion use in the exam room, which is a little sort of strip, if you will, and allows us to measure certain types of compounds, something called thiols, which are usually produced by the activity of what are called anaerobic bacteria. Anaerobic bacteria are bacteria that come to predominate in the mouth as periodontal disease progresses. So when you have a lot of these thiols present, as measured by this test strip, it's a pretty good and fairly evidence-based way of saying, yes, in fact, this dog is, if it hasn't already, it is moving in the direction of developing real periodontal disease. And this may be the time that we want to act. And I think it's worth mentioning, we're talking about, at least I'm describing scenarios where teeth may seem quite bad. Our goal is not to wait to get these patients when they have more severe periodontal disease. The goal is to get to them very early on. Not only fair to the pet in that they don't go through prolonged periods of discomfort, but at the same time, for you as the owner, it's a heck of a lot cheaper. There's far less work that we end up having to do to maintain the mouth than when we have to go in and perform major oral surgery in order to save the mouth. So our goal is always to get in there right as we're sort of crossing the threshold, not until we're well down the road when we risk losing 10, 20 teeth. So what does treatment really look like? Well, the first thing, and I'm going to sort of leave this to the part of the discussion after we talk about the procedure, but what does it look like when you come in? Well, once we do our initial assessment in the room, to be fair, we're putting together an estimate. There's actually a lot of parts that go into this, and usually there are at least 3 people involved with a patient at any one time. A technician who's performing a lot of the sort of investigation and cleaning functions, just like a dental hygienist, a second person who's supervising the anesthesia, and the third person being the veterinarian who will do any of the major work and certainly look at all the information gathered to make a determination about how we move forward. So we treat these patients when they go under anesthesia in much the same way that we would treat a patient who is undergoing a major surgical procedure. It's exactly the same drugs, the same type of monitoring takes place. Now, when we get there, when we get the patient on the table, and I should point out that sometimes you'll hear me or certainly us in the room refer to this type of procedure as a COHAT versus a dental. In veterinary medical parlance, a COHAT just stands for Comprehensive Oral Health Exam and Treatment. For the purposes of the discussion, I'll refer to it as a dental. Once we get them, the first thing we tend to do is we go through and we use special instruments, just like your own dentist, to probe the mouth. We're looking for obvious fractures. We're looking for exposure of roots. We're looking for mobile teeth. We're looking for pockets around the teeth, or even what we call frications. Teeth that have several different roots can literally have a hole that passes between them that should normally not be present if the normal tissue was surrounding the tooth. Obviously, there are other things we're looking for, masses, abnormal growths, again, to create this composite picture of what we're dealing with. Once we complete that process, and certainly it's one that the veterinarian will participate in if there's any question about what's going on, we then sort of graduate to taking the radiographs. And, obviously we do this in both cats and dogs. And the key here, again, is for us to image what's going on underneath the gum line, in and around the bone and the jaw. And believe it or not, and this is just one case example, you might say to yourself, wow, if a dog or a cat had an abscessed tooth, that might be exceedingly painful, so much so that, maybe they wouldn't eat. Well, I think as Dr. Penn could also attest to, you'll be surprised at times to see how many teeth could potentially be abscessed or affected severely, and even compromising some of the bone around the tooth root. And yet these patients are still eating and drinking and caring. So, once we take the x-rays, we then take the information we got from the probing, we put everything together, and we decide on the course of action. And what we decide to do is really determined on, well-established criteria in veterinary medicine. We're not just freelancing here. For example, when we have a mobile tooth, certainly a mobile tooth has already lost so much of the structural integrity that there's very little we're going to do to save it. And since it's a source of pain, we're just going to extract it. But in cases where we have, say, fractured teeth, fractured enamel, but yet the integrity of the tooth is mostly intact, we might go the route of trying to seal or bond the tooth in an attempt to save it. Certainly, and within veterinary medicine, we have sort of a specialty field. We do have what are called board-certified veterinary dentists, and there are circumstances when we really need to call in their services or even refer patients for certain services they offer. So, for example, if we had a very large dog that came in that had a fractured canine tooth, one of the big fangs, one of the things that we need to consider is that if the owner wants to preserve the appearance that the dog has and wants to keep that tooth, then one of the things we might need to consider doing is sending him to the dentist, having a root canal performed, and a crown applied. It's not something we do. It's not something we're called on to do very often. And admittedly, it's an expensive thing. So many clients don't opt for that course of action. But again, when we're in the mouth, we're finding pockets, for example. We have the ability to use some compounds to try to get some of the gum tissue to readhere to the base of the tooth to prevent deep pockets from forming and ultimately destruction of tooth roots. In cats, for example, if we do have a tooth that's somewhat compromised, sometimes we don't even have to go through the process of actually extracting the tooth. We just remove the top of the part you see called the crown and leave the root intact. Oftentimes, certainly in a cat, that root over time can be reabsorbed. It's easier on the cat, especially when you consider at times the size of especially the lower jaw in a cat, and the possibility that any extra manipulation or excessive manipulation could actually lead to fractures. And believe it or not, that is a risk, I would say more often than not, in the small toy breed dogs or even cats that have had long-standing periodontal disease. That periodontal disease extends from the mouth, the oral cavity, down into the bone and beyond. And when that happens, you can risk a jaw fracture. And that's certainly another indication where we need to bring in the board-certified veterinary dentist to help us repair the damage. Now, I would say, one of the biggest concerns, setting aside the concern with respect to anesthesia, is always, okay, gee, are you going to have to take my dog's teeth out, and what's going to happen when you do? Well, as I said, the adult dog has 42 teeth. The cat has 30. And it's sort of a running joke at times because the environment that most of our pets live, do they really need most of their teeth? For example, do they need the 4 sort of fang teeth they have? Well, technically, no. Those teeth evolved to grab prey and hold prey, and ultimately, compromise blood flow, breathing, and so forth to kill the prey animal so that they could feast. Well, let's be honest, most of our pets are not in that type of situation. And the same thing can be said for a number of the teeth behind the fangs called the premolars. We sometimes affectionately joke the veterinary dentists here in town, when you ask them the question, well, how many teeth does, this dog actually need? And sometimes they say about 8 of the 42. But in reality, we have both dogs and cats that we see that over time have lost teeth because they have such a strong genetic predisposition towards getting periodontal disease that they've lost these teeth, and yet they still eat rather well, including eating hard food you'd buy out of the bag and feed to a totally healthy, 2-year-old dog. So extraction, believe it or not, even though it's not something that a human dentist would often reach for as a treatment choice, is something that at times in veterinary medicine we rely on quite a bit. But we do so when we realize or recognize that we cannot save it beyond the point where we can do anything to adequately repair it, or it's in a situation where it's at high risk for, say, developing an abscess or an infection. And so you have to realize that, extractions will take many forms. Certainly when we have these mobile teeth, which are painful, they can be removed with relative ease. And of course, when we're removing these teeth, we'll oftentimes suture the tissue back together using suture that's dissolvable. And fortunately, the mouth heals very, very quickly. But by removing that mobile tooth, they actually feel better, even though we're doing a surgical procedure. And, as we move to some of the larger teeth, the teeth with many roots, we then find ourselves in a situation at times when we do have to truly do oral surgery, meaning we have to create flaps of tissue. We have to remove some bone around tooth roots to get the damaged pieces of tooth root, extract them completely, and then put everything back together. And of course, when we do something of this magnitude, we're always using x-rays after the fact to make sure that we've done it to completion. And while this may sound like a lot, and again, it truly is surgery, believe it or not, when you have a tooth that's very painful, sometimes it is still a huge relief. The good thing is that, we can do a pretty darn good job of managing pain these days, especially during that acute period, a few days after the procedure when they're going to be most sensitive. As I said, the mouth heals very quickly. And when we see these patients back 3 days, sometimes 7 days later, it's amazing how well they're doing, having gone through a procedure at times, which, easily could be very significant. So when we're talking about having to remove teeth, one thing that I try to always avoid is certainly quote a number, but recognize I'm only removing teeth rather that need to be removed. I have no desire to sit there and remove any teeth that are not necessary, that are not diseased in any way. But, and this is a shock to some people, even in situations where we have patients come in with such severe periodontal disease that we end up removing, say, 10 or 12 teeth, these patients almost always feel better because those teeth were so uncomfortable that once they're gone, it provides almost immediate relief. And again, that's not something people are used to hearing based on their own experiences at the dentist. But for us, it is the route we oftentimes go because obviously we're a little less concerned about the cosmetic appearance. And again, the costs involved for salvaging some of these more major multi-rooted teeth, are significant. Now, I always get asked, well, how long is it going to take? Well, truth is, we never know. Until we get in there, until we characterize the problems, I cannot tell you how long your patient, your pet is going to be under anesthesia. What I can tell you is, based on the magnitude or level of work that we do, we are going to really try to manage pain as well as we possibly can. We do that not only by numbing certain nerves so they don't feel pain, just like your own dentist does, but by sending pain medications home for a number of days so that even though they might be sensitive, they're comfortable, they can still eat even things like, softened food. But that's essentially what we're looking at with respect to the procedure. And, admittedly, I've simplified it, but believe it or not, for us, oftentimes it's a little bit more complicated. There are a lot more parts to it than what you might imagine with a surgery, even something like a spay or a bladder surgery or a surgery on some other abdominal organ. This is why at times, and we'll get to this a little bit later, why, the cost of doing the procedure properly is higher, or at least shocks some people sometimes. So one of the other things I wanted to point out is that, and perhaps this is a good time to mention it, is the strategy that we try to employ when we're talking to owners about the costs is one that prepares you for the worst, knowing full well we're likely to overestimate this, not only the severity, but the costs. And there's a simple reason for that. As I was saying, because of the need for x-rays, because we can't fully assess the mouth just by looking at it in the exam room, I want to be fair to you. I don't want to call you with any major surprises about cost. I also want you to know that, when we do get a complete picture, we're going to try to make the most appropriate choices for the pet so they come out of this procedure hopefully feeling great. So yes, oftentimes we provide, an overestimate, if you will, to you as the owner. But I can tell you about 98% of the time, we end up coming well under that estimate. It's not uncommon for us to be surprised in a good way and find that there's a lot less work that we have to do. And believe me, from my perspective, I really do enjoy that when I can get in and out much more quickly. So once we brought these patients back to square one, what do? Well, we actually have a variety of options for helping to manage the risks of periodontal disease at home when you have a clean slate. And I say manage the risks because certainly in a lot of patients that have a higher sort of genetic predisposition, like your small breed dogs, for example, we're not going to stop it. We don't have anything that will sort of freeze that mouth in time and stop it from getting periodontal disease again in the future. So we rely on owners and various different strategies, again, whatever's going to make the most sense for you and what's going to be convenient to try to slow it down and minimize the impact. But it is by all means not uncommon for a pet, again, taking your small breed dog, to have multiple sort of cohats or dental procedures over the course of its life to maintain the integrity and the health of the mouth. The products that we tend to use fall into a category of products that are approved by the Veterinary Oral Health Council. Basically, you have a group of veterinary dentists who tested these products and find they do what they need to. That can take the form of foods at times. It can take the form of certain types of treats, water additives. But of course, if you ask veterinary dentists what they feel is the most effective option for managing periodontal disease, or at least pets who are at high risk for periodontal disease, that's toothbrushing. But really, if you're not going to brush your dog's teeth at least 3 times a week, there's limited value to be had. If you take your pet to the groomer and ask the groomer to, brush your dog's teeth once every 3 months, you're not really getting the full benefit. That said, one of the things that I tend to rely on are things that will more likely get used on a daily basis. So, for example, we have a food made by the Hills Company called TD, and it's designed to be very, very hard and abrasive. The idea is it has sort of a scraping action on the teeth, removing a lot of the plaque and tartar and some of the bacteria that are going to want to accumulate. And while you could use it as an adjunct to what you normally feed, or even feed it exclusively because it meets all their nutritional guidelines, the thing that's nice is that it's very easy, because if you mix your food and the TD together in a bin and you're feeding your pet every day, they're getting the benefit of it. And that's really key here, is that anything we would recommend to you to help manage or mitigate the risk of periodontal disease in the future has to be used on a regular basis. So at the end of the day, it may not make a difference what you use as long as it's used consistently. Now, of course, the risks for patients, we talked about the small breed dogs, we talked about patients that have certain underlying diseases that would impair their immune systems. And certainly, we talked a lot about dogs tonight, but cats are really in the same situation. Cats present a little bit differently. You're not probably going to appreciate as strong an odor or see as strong buildups of tartar or plaque on the teeth, but you certainly can appreciate the redness and thereby the discomfort they're likely experiencing. Cats, and one of the main differences between cats and dogs is that aside from having fewer teeth, is that cats actually get something more akin to a cavity that we experience as people. We call it a furrow, a feline odontoclastic resorptive lesion. And it usually occurs right around the gum line, but it's a hole, a tunnel that literally develops in the tooth and can be a great source of pain or discomfort. And by the way, all these sort of post-procedure options for managing periodontal disease apply to cats and dogs. Admittedly, I don't know many cat owners who train their cat to allow them to brush their teeth, but certainly it's a possibility. But things like the special foods, the water additives, and even certain specialized cat treats have all been developed with this sort of VOHC seal of approval that would allow you to over time mitigate the risk. So this is sort of a dental procedure in a nutshell. The last thing I wanted to touch on just a little bit more is, of course, this notion that we need to use general anesthesia. And as you can imagine, between having to use metal instruments to investigate the mouth, as well as taking x-rays or radiographs, and then, of course, going forward with any type of repair or resuscitation of damaged tissue, all of this really cannot be done safely while the patient is awake or even heavily sedated. At the same time, because we use water and a lot of other solutions, we want to make sure that at all times we have control of their airway so we can protect it. So these fluids don't make their way into the lungs and, as you can imagine, cause any additional types of problem. So by having these patients properly positioned under general anesthesia, we can perform the procedure safely and completely. So we're treating this patient and sending them home, hopefully pain-free. And you realize that the drugs that we use, the anesthesia drugs we use, these are all human drugs. These are drugs that are used in pediatric medicine every day, and they tend to be very short-acting drugs, which allow us much more control over the process. And this is why, we typically have the pets come in the morning, we send them home at the end of the day. It's not because, this procedure was going on for hours and hours on end. We want to make sure they have ample time for those drugs to clear their system, and they basically go home the same way they came in. Alert, aware, maybe hungry, happy to see you, and hopefully feeling pretty good. So while I understand the risk, and there have been a number of studies that have actually looked at the risk of anesthesia in pets, the truth is exceedingly small. close to or slightly less than 1%. And while it's never going to be zero when done properly, even in patients that have underlying what we call comorbidities, other diseases that we might need to consider or factor in, we do try to screen these patients early with blood work to look at major organ function, but we can still sort of titrate the anesthesia to meet that pet's needs safely so we can do the procedure that they need to have done. So with that said, I've jabbered on long enough. I wanted to give you guys a chance to ask questions, or even, if you wanted to dive deeper in any particular issues, and certainly allow Olivia to chime in with any comments or, information that she feels would be pertinent or relevant to the conversation. Don't everybody be bashful. Don't everybody raise their hand at once.
I did have a question for you. We have a golden doodle, and she is pretty small. She's only like 22 pounds, and she has this wonderful underbite, so she can lock down her mouth, and there's no way we're getting in there. So I'm just wondering, with the food and stuff, we've also been told by other folks like dental chews or using like goosenecks or something. And I'm just wondering, are those actually viable options, or is it better to stick with like the food you mentioned?
So again, the most important thing is using something, finding something you're going to use consistently. The second consideration is finding something that's actually been demonstrated to work. I don't really understand how a gooseneck would provide that. I think you'll find that a lot of the, what's called like chewable treats, tend to be manufactured more than sort of natural products. For example, you can oftentimes see like cow bones sold in the store, and it's not a great chew toy. I mean, it's very hard. Dogs can fracture their teeth. You can get bone splinters. They can swallow pieces of the bone out, which can be problematic. And I should point out that many of these sort of manufactured chews also have other for lack of a better word, ingredients that are added to at times, retard the accumulation of plaque, or sometimes they have even antimicrobial compounds. So, rather than using sort of naturally derived products like goosenecks or hooves or bones, if you want some sort of chew, a product that they can chew on, you want one that has like the VOHC seal. One product that we use that falls into that category is called Oravet. It's a product, I don't know, they come in different sizes, but it's a sort of a bar, if you will, a green and white bar, has sort of a plant-like scent to it. It's designed to be consumed so they can swallow it, it can pass through without any issues. But it does, again, help manage the risks of periodontal disease. Admittedly, there are a lot of products out there, but not all of them meet this type of criteria. So therefore, it's important that you see, it's usually going to be prominently displayed on the package, the VOHC sort of seal of approval. And if that's the case, it's likely to work. But as far as the food is concerned, again, I like it only because most dogs are eating every single day. They're getting the benefit of it, and owners don't necessarily have to think about what they need to do because, as long as that bin of food lasts, just by default, that dog is getting the benefit of it. Michael, you got your hand raised. I like that.
Now I had to find out how to unmute. Okay. So we have a little micro golden doodle. So he's 9 pounds or so. I think you've seen him. But so what we've started to do is when we come in for grooming to your place, like we have her brush his teeth, and then in between, like I've never brushed his teeth, but we give him like those greeny dental treats. Like, are those effective or do any help?
Remember, Olivia, do you remember if the greenies are VOHC approved?
I'm looking at the front of it. It just says vet recommended for dental care, unique texture, fights plaque and tartar.
If it was, you would see a little symbol, a little circular symbol, and it says, big letters VOHC.
Yeah, it doesn't have that on it.
Yeah, it's not. So the Oravet product I was mentioning a moment ago is actually very similar to the greenie in terms of appearance and texture. And that is one that a lot of us in practice do use and use effectively. But no, I mean, not that the greenies cause any harm, especially now that it was reformulated, but it's probably not having the desired effect. And again, it's also one of those things, just like the Oravet, where the Oravet, they sell these things in like a 30-count bag or box because they want you giving one every day to maintain the benefit that's had. Believe it or not, when we perform one of these dental procedures, within 24 hours, you're already starting to get these films that are produced by bacteria on the teeth. It's that quick. And technically, within about 72 hours, you can actually get some tartar, some like slight mineralization if you're not careful. So, even though we do the procedure, all these organisms go right back to work. And so anything you choose, again, has to be applied consistently. But if you want to use a product like that, certainly Oravet is an option. We do have a list, and you can actually find a list on the website for the American Veterinary Dental College. They actually have a list of all the VOHC approved products that they recommend.
Thanks.
Amy.
Hi, I have a cat. He's 10 years old, and I was going to be scheduling him for a procedure, periodontal procedure, but then he got sick in January, and had pancreatitis, and they did a bunch of lab work and found, that we have to keep a watch on his kidneys and liver. And so I'm wondering, how healthy does the cat have to be to undergo this procedure, and like, do I need to wait a while?
So I wouldn't necessarily, especially if the bout or the episode of pancreatitis has resolved, I wouldn't necessarily consider that an added risk for anesthesia. With respect to the kidneys, certainly, we do put a lot of patients under anesthesia, mind you, patients that are advanced in age, patients that have diseases. And, just a side note, people want to sort of equate age alone with an increased risk of anesthesia. And there's not a sort of a direct correlation necessarily between the two. So, the best thing is we have to look at your cat's blood work and overall health. We certainly want to make sure there aren't any other mitigating factors. But even a cat who had some mild, kidney insufficiency is still a patient that we can safely anesthetize and perform the procedure on. It's not, I wouldn't describe it as a significantly increased risk just because of that. If you ask me what would be a significant risk for anesthesia? Well, a patient with a very significant or severe heart murmur that was not adequately diagnosed and treated or compensated for, sure, that's a patient that could easily have a complication relating to anesthesia that we could otherwise avoid. But I'll say, just speak from experience, after nearly 24 years of being a vet, the pets that I have seen, albeit not many, but over the years, the few that I have seen that have had sort of sudden, acute, life-threatening issue with anesthesia, admittedly are not the patients who you'd expect to have an issue. These are patients that typically look good on paper. But they, on rare occasions, a patient can have an idiosyncratic or unexpected reaction to one of the drugs we use. Again, it's an exceedingly uncommon thing to have happen. But again, anesthesia is not a completely risk-free proposition. But the problem you describe is a manageable one, as long as we have all the information about, how the kidneys are actually doing their job.
Okay. Thank you.
Hi, Dr. Josh. This is Anisha. I'm sorry, I don't know how to raise my hand.
No worries, no worries.
But real quick, we have a 15-year-old Maltipoo who appears to be in good health. Does have a slight, odor coming from the mouth. And I think you answered my question, but just to make certain, age alone is not the factor that you look at about the risk of anesthesia. It's really the overall health. Is that correct? Blood work and all of that?
We're going to look at the patient overall. We're going to look at the patient's blood work, complete the physical, try to identify any other things that could be a concern. I think it's probably fair to say that, an older patient may require an extra day or two to kind of get the wind back in their sails and get their strength back. I don't think that's uncommon or unreasonable to expect. But just by virtue of being older, that doesn't by itself raise the risk for anesthesia. One of the other things, as I said, is that we try to use drugs that are extremely short acting. So even during the course of a procedure, if we identify something that we need to address, in many cases, we can reverse the drugs we're using, remove them very quickly. and make the necessary adjustment. But yes, in answer to your question, age itself is not the only consideration, and just being of an advanced age is not enough to exclude a patient from a procedure.
All right, thank you so much.
Other questions that come to mind? Amy, is that hand raised? Yeah.
Yes, I was just curious as to what the average length of time the patients are under the anesthesia.
So it does very much depend on the amount of work that ultimately needs to be done. I would say that, I could probably, talk to you about the low end. I would say the low end is probably closer to, 40, 45 minutes in a patient that's truly just having what you might, think of as just a cleaning without any other issues whatsoever. But the high end, again, that depends. I mean, if I had a dog that came in and they had just a number of extractions, we could be in there for a few hours. I would say that's a little less common these days because, again, we try to identify these patients early whenever they come in to see us, so we don't get them, late in the game. But, when there is work that needs to be done, I mean, as I was describing, sometimes the need to create a tissue flap and remove bone, it could take, 15, 20 minutes on a large, complicated tooth to treat it appropriately, get it out, and then put the tissue back together. So I wish I could give you a better, more exact answer, but if you're talking about like the minimum time from the time they were induced under anesthesia and then recovered, I probably, say around maybe 45 minutes.
Okay. Thanks.
Other questions come to mind? Olivia, did you want to chime in with anything?
No, you're good. Sounds good.
Okay. Seal for approval. Well, if anybody does have any additional questions, you can always, reach out to us. That's not a problem via, email, phone, anything like that. And then, if anybody else wants to view this or, anybody who wants to view it, Leslie, my admin here, puts it on our YouTube channel. So there'll be a copy of the Zoom there. But with that said, I want to thank everybody for their attendance this evening. Hope everybody has a good night and stays away from the crazy traffic around us right now. So,
Thank you.
you're welcome, guys.
Thank you.
Thanks.
Thank you.
You're welcome.